Antibiotic resistance is a serious global problem. The inappropriate use of antibiotics around the world is causing bacteria to develop resistance to their effects. To keep antibiotics working, we need to implement global solutions to ensure that they are only used when really needed. To do this on a global scale, we need to address the different ways in which antibiotics are viewed and used across different cultures, resources, and healthcare settings. To better understand these cultural differences, we took a social science approach and interviewed 54 healthcare professionals working in 24 hospitals across 5 countries: England, Norway, France, Burkina Faso, and India. Overall, we identified 4 key issues that need addressing. Number 1, in some countries, access to antibiotics is too easy.
In India, access to healthcare is a problem. In many places, the first contact is alternative medicine, a quack, or an untrained pharmacist. People coming to the hospital may have already taken antibiotics, so taking microbiological samples from them is pointless because the results will be altered by the antibiotics they have taken. We also have a problem with counterfeit medicines.
Number 2, professional boundaries and respect for hierarchies can limit who can participate in decisions on antibiotic prescribing in hospitals.
In India, the hierarchy is really strict. The nurses will not be able to say to the doctors, "This is not correct," like they can in England. They won't have the confidence to say that here.
France is a very hierarchical system. It's like working with an army of Napoleons. People think, are you a member of our team or not? And this is why it's impossible for nurses to be involved. She's a nurse. She's only a nurse. And for pharmacists, it's the same. Some of the pharmacists feel that they can't be involved. They say, I'm not a clinical doctor. I can't tell a doctor you have made a bad choice. It's impossible. You see, in France, we see this examination for doctors, the concours. It's not an exam, it's a battle. You are not doctors at the end. You are gods. And you can't question gods.
Number 3, the use of antibiotics in surgery needs to be optimized.
Another problem is the huge irrational antibiotic use in surgery. I find most surgeons feel it is my patient who is at stake, so I must treat him irrespective of cost or whatever stakes that there are. I really don't care about tomorrow.
Some units like surgery trust infection doctors very quickly because they don't like to deal with infectious diseases. We save them time. They care more about the surgical problem. They say, we will do the surgery. The rest is your problem.
Number 4, there is a need to improve the support from governments and local authorities.
In Burkina Faso, we don't have adequate support from the authorities. There are no national initiative or guidelines. Local antibiotic policies are based on the French system, which is not fit for purpose in our healthcare system.
In Norway, we have guidelines, but I think it's difficult to get all the doctors to see how important this is. There has to be really motivated people in the hospital to get the others to understand that this must be done.
In India, guidelines appear to be more acceptable if it is believed that they are initiated by the government. The respect for government authority has a higher value than any local enforcement like local guidelines.
What we learned from this study is that there are some universal obstacles standing in the way of improving antibiotic management. Using social science research, we have identified these problems across different settings, which means that we can now take action and keep antibiotics working and treating infections around the world. What we now need is to see governments, policymakers, and hospitals come together to make 3 things happen across all settings. Firstly, we need to address the access to antibiotics. Secondly, we need to champion greater involvement of wider healthcare professionals in antibiotic management. And lastly, we need to focus on improving antibiotic use in surgical pathways. However, to be truly effective, we need this approach to be embedded in the hearts and minds of people and not just through legislation. We need a shared understanding amongst healthcare teams and professionals to commit to supporting each other and to optimize the use of antibiotics worldwide. Together, we can keep antibiotics working and tackle this global problem.